In recent years, the state and individual counties have spent millions developing programs and solutions to try and address the ongoing homelessness crisis here in Hawaii. With the cost of living continuing to rise, is the government doing enough to reduce and solve chronic homelessness? Join our conversation as we discuss what is being done at the local level to resolve this long-standing issue. Next on Insights on PBS Hawaii.
Aloha and welcome to Insights on PBS Hawaii. I'm Yunji de Nies. In Governor Josh Green's inaugural State of the State address in January, he issued an emergency proclamation concerning homelessness. His predecessor, Governor David Ige, made a similar proclamation when he took office. Governor Green's emergency order clears some governmental red tape around the construction of kohale, or tiny homes with shared spaces for cooking and bathing to house homeless individuals. Hawaii's homeless crisis is unfortunately nothing new, but there are a variety of innovations to address this problem taking place at the state and county levels. We want to explore those solutions tonight and talk about what's working and what still needs work. We look forward to your participation in tonight's show. You can email or call in your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook and YouTube pages. Now to our guests. James Koshiba was appointed the governor's coordinator on homelessness earlier this year. Before that appointment, he was the director of the Haole Mauloa Foundation, the managing director of social ventures, and the executive director of Kanu Hawaii. Anton Krucky is the executive director of the Office of Housing and Homelessness for the city and county of Honolulu. Previously, he was the general manager of IBM Pacific and the president and CEO of Tissue Genesis Incorporated. Connie Mitchell has led the Institute for Human Services, or IHS, since 2006. Prior to IHS, she established a nurse-run rural clinic on Hawaii Island and was the director of nursing at the Hawaii State Hospital. She also serves on the board of the Oahu Workforce Development Council. And Adam Roversi has served as the Kaua'i County Housing Director since 2019. He studied Native Hawaiian and environmental law at the University of Hawaii at Manoa. Prior to his appointment as housing director, he served as a deputy attorney for Kaua'i County. Thank you all for being here tonight. This is such an important issue. I want to start with you, James. You know, we reference at the top that this is an issue that every election cycle we hear politicians say that this is going to be different. Their strategy is new and innovative, and yet we seem to end up with a similar result year over year. What do you think is different about your office's strategy?
So a couple thoughts on that. One is, I think it's important to take into account that the larger context, which is on this issue, we're facing into a headwind, a persistent headwind of rising housing costs and wages that don't keep up with that. So we have that gap, and that gap continues to grow. And so there's always going to be pressure on the bottom of our safety nets and on our marketplace, and pressures that actually will lead to a rise in homelessness. But to answer your question, I think in short, there's two things that we're trying differently. One is, our observation, my observation, is that one of the pieces that has been a bottleneck in solving this problem has been we don't have that deeply affordable space for people to be housed and healed at the end of that continuum of care to get people from street to home. So we're squarely focused on creating more of that space. Kohale is one mechanism to do it, but it's not the only mechanism. But we really want to expand that inventory of space that's affordable to people at the very bottom of the income scale so we can get folks from street to home. The second piece is, and this is not something new, but our existing system, that continuum of care, from outreach to temporary shelter to transitional housing and case management, that whole system needs to be fortified significantly. Other folks around the table can tell you there's staffing shortages on the front line of outreach workers and shelter workers. That system needs to be resourced differently so that once we do have that space, we can get people along that pathway and bring them home.
I want to get into that deeply affordable model in a little bit, but first let's talk generally about some numbers, and we have some graphics to share with you tonight from the point in time count that was taken in January of this year. The first one looks at homeless folks on Oahu. When you look at the numbers, just over 4,000 the year before, just a little bit under. We focused in on keiki in that count as well. If you look at homeless keiki on Oahu, you're looking at 559, again, a slight uptick from the year before. Of course, this is not a problem that is unique to Oahu. It also affects the neighbor islands. We have those numbers to share with you as well. When we look at the homeless numbers on the neighbor islands, this is collectively excluding the island of Oahu. We're looking at 2,195, an increase over the previous year. And looking again at those numbers of keiki, 341 in 2023, an uptick from 2022. Connie Mitchell, when you look at these numbers, what do you see?
I see that despite a lot of effort, providing services, trying to outreach people, we continue to have a problem. But as James was saying, it's a long-standing problem. The affordable housing problem has been decades in the making. It is not just something recent. And I think we really need to see it in context also of a national crisis that we're experiencing. I personally feel like, okay, we did go up a little bit, but when we look at some of the other cities, on the West Coast and elsewhere in metropolitan areas, homelessness has exploded, and it's just something that's unfathomable. And so I feel like, our continual care, the neighbor islands continual care, we really work together, to really try to leverage each other's strengths. But it's really still tough because the resources are not always there, and we don't have the housing inventory that we need.
We know that Kaua'i in particular has a housing shortage. So I want to go to you now, Adam. We saw those neighbor island numbers. This is not a problem, as we mentioned, that is unique to Oahu. What do you think is different about the issue on the neighbor island, specifically on Kaua'i, as it compares to what folks are experiencing here on Oahu?
Well, we clearly have a lot of similarities in that we have the exact sort of crisis James is talking about of a lack of affordability. It's frustrating in that we've been doing some great work, I think, with the sort of supportive housing, low-cost supportive housing models that James is talking about, serving almost 100 families in the last year, getting 60 families into housing, but still our numbers have gone up. So clearly, systemically, we're having more people fall into homelessness despite our efforts to create low entry, low cost housing situations for them. So we need to do more, and we need to do it more quickly.
I want to look at one more graphic that we have tonight to kind of give a context to what people may be facing who are in this circumstance. We looked at some of the demographic data that was shared in the point in time count, and these numbers come from Oahu, but there was a survey of unsheltered folks in that point in time count report that came out. 62% reporting one or more disabling conditions, and these are self-reported, so we just want to make that clear. Close to 40% reporting a mental illness, 36% of those folks chronically homeless, 22% 60 years or older, and we know that we want to talk about kupuna tonight and the unique challenges that they face. But Anton, Krucky, I want to bring you into this conversation because we know that the city has been trying a new strategy through its core program to try to help some of those folks. When you look at those other issues that these folks are facing, one or more, over half, one or more disabled conditions, what do you see in those numbers?
Well, first off, in November of 21, the mayor moved me over to be the director of the office of the Department of Community Services. So that gave me a lot of tools to still work on homeless, which he asked me to continue to do. So I have 5 divisions in that department, and they all touch homelessness, right? I have a Work Hawaii, which does job training and gets people ready to house, rent-to-work programs. I have the Customer Assistance Division, which is our public housing, so all the voucher programs, home rehabs, all the things that touch there. Community-Based Development Division, we're the ones that invest in properties that then we can contract with service providers to do services. We also have 72 special needs housing around the island, right? So 72 of those where a different service provider would be working with groups of people. I also have to do the grants and aid, which are to service providers for them to provide their services. And then I also have Elderly Affairs Division, and you touched on that number. And in Hawaii, not only in the homeless population, but we have one of the greatest and fastest growing elderly population. And that has a whole different effect on housing than the population that we're also trying to keep in Hawaii, right? So we have a lot of dynamics that are operating there. But the key strategies that we're trying to do is we want to do everything we can creatively, and you mentioned CORE, and we can talk about that, and Jim Ireland that runs that program, everything we can do creatively to get someone to engage the system. And then we analyze all the resources we have, because we're more of an execution arm for the island, all the different services and resources we can provide to service those decisions. And so everything I'm doing kind of works within that strategy.
Okay. I want to talk about CORE in a moment, but let's go back to Kauhale. I think a lot of folks are aware of this concept now that we're seeing it more and more in our community, not just on Oahu, but also on the neighbor islands, but specifically across the street from the Queen's Medical Center. We've now seen this medical respite center. Tell us a little bit more about how that's going. It's been open, I believe, about a month now. Yep. You know, who's utilizing those services? How long are they staying? And can we expect more of this? Because last I heard there was a wait list.
Yeah. So I just want to correct one misperception about Kauhale. I think people normally envision tiny homes with shared bathrooms, kitchen, facilities, but it doesn't have to be that. You know, Kauhale, we intentionally call it Kauhale because it's village-style housing. But what we mean by that is we want to create spaces where people are taking collective responsibility for their space, forming community and relationships and supporting each other, taking care of the place and each other. And we'd like to experiment with cost-effective models of creating that kind of community space. Tiny home villages is one example, but you could have a kauhale in a repurposed dormitory, a repurposed office space, an apartment building. Really, it's that building of community, the shared responsibility, and the cost-effectiveness that we're aiming for. But to answer your question about the medical respite kauhale, so yes, it's been up for about a month. It's full. There's a waiting list for people to get in. It's taking referrals from urban Honolulu hospitals, the 3 urban Honolulu hospital systems, so Kuakini, Hawaii Pacific Health, and Queens. And it's really designed to address, you know, a very visible problem that we're all familiar with, people being discharged from hospital straight to the sidewalk and languishing there. And so the folks that have been referred from the hospital systems run the gamut, you know, folks that are recovering from a stroke. There's one resident there that just started chemotherapy. Other residents that have not only physical, but some behavioral and mental health challenges as well. I guess the thing that's been a pleasant surprise to me is we did try to set the tone that even though this is a temporary space and a temporary village, that we do want to foster that sense of community and of responsibility. And it's been amazing to see people, the residents in there, really take that to heart and form relationships, support each other. I was sharing earlier as we're getting ready that one example I'll give is I mentioned one of the residents there just started chemotherapy about a week and a half ago. Another resident who she met in the kauhale now takes her to her chemotherapy appointments, you know, almost daily. And there's just one example of the way people are supporting each other and supporting each other's healing and growth. And that, I think, is a missing element in a lot of our existing systems. Just having people support each other in that way can take us a long way toward the kind of healing and growth we want to see.
You mentioned that it is full now, mm-hmm. and there is more need. Can we expect to see more of similar kauhale in the future? And you got this one up and running very, very quickly. Are you working? What kind of a time frame are you working under?
Yeah, so I'm not sure about, so what we're doing in conjunction with opening this space up is trying to get permanent bed spaces for medical respite opened up in the community. So working with folks like CORE and other operators to find space to make sure they have the resources to staff up, which is why this medical respite is temporary. So once those bed spaces are open, we'll take those units, those tiny home units, and we'll use them at a permanent kauhale site. Because that really is another key to the vision for kauhale, is we want these spaces ideally to be long-term spaces for people, because that's the missing piece, right? We have some temporary spaces, we have transitional spaces, but where do people transition into afterwards? We're looking for kauhale to be long-term, deeply affordable space for people.
Adam, what do you think about this model, and how can it be used on Kaua'i and on the neighbor islands in general? I mean, you're here speaking not just for Kaua'i, but we also want to bring in the neighbor island perspective. We know it's different on Hawaii Island and Maui, but what do you think about that model, not necessarily just medical, but of that kauhale village, and do you hope to have more of that in your community?
Well, we've been doing a version of what James is talking about. So under the former governor's original emergency proclamation, we built our first supportive housing project of 28 units. It's very similar to the model James is talking about. They are very small, tiny homes. They each have their own bath and kitchen, but it's been a dramatic success on Kauai. We've had, quick numbers, we've had 63 different households, almost 170 individuals in 2 years move in, and more than half of them have successfully moved out to permanent housing. Only 3 families or 3 residents who moved into that facility reverted to homelessness, and everyone else has successfully stabilized their lives and moved on to other permanent housings. Or, well, 50% of the people have moved on, half are still there, and the key to its success is the supportive services that are provided to the residents on site. So a condition of residency in this community, which is everyone can get to know each other, support each other in the way that James is talking about. But the key to its success is that our nonprofit partner, Women in Need, provides a customized care plan for every family and individual who moves in. It's not a one-size-fits-all cookie-cutter set of social services. It's designed to fit their needs, whether it's rebuilding their credit or substance abuse counseling or helping them get, complete their education so they can find better employment. And it's been great. We're building our second one right now, 32 units on Kauai, and we hope to be able to construct one of those facilities in every district of our island. And to be blunt, they're not that hard to build. They are harder to operate, and they're harder to continually fund because it's expensive to provide those social services. And we look to the state to continue giving us support to make that happen because we're a small island with limited resources.
Well, and I'm also interested on what kind of a community response, because I know that, James, when you came into your position, there was a lot of talk about the Kaua'i and the governor saying that he wants to build, I believe, 24, and
A dozen.
Just a dozen. I
In
thought
the first three, in the
I thought
first
it was
term.
2 dozen. Okay,
In
a
the first
dozen. Saying that he wanted quite a few of these, and there already was resistance immediately to saying, well, we're not the right district, we're not the right place. So if you want to build as many as you're talking about, do you expect there to be any NIMBYism when you try to lay these out?
Definitely, and in pursuing, but I think we can overcome that, and we have in some very specific instances. So we're right now seeking a 3rd site on the east side of Kauai, and when we put feelers out into the community about our intentions, there was clear and immediate blowback that we do not want this in our community. So I invited the leaders of the community to come to our existing Kealaula supportive housing project, to meet the people that we're running to see what it looks like, to talk to some of the families there. And every single one of them left that day saying, we're comfortable having this in our community. Once they realized what it actually was, that it's beautiful, it's well planted, it's well maintained, there's children riding their tricycles around on the sidewalk, there's not garbage everywhere, there's not tents, there's no crime. So once they saw what that model really can be, they encouraged us actually to bring that to their community.
I want to bring in the audience on this, and thank you so much for those of you who are already writing in and calling in your questions. Connie, if you could take these two. One's from Kaimuki, one is from Kaua'i, and similar here, questions here. With airlines offering low-cost flights from the mainland, how do you deal with homeless coming from the mainland? How many of our homeless are from the mainland? There is this perception that other cities, send them here on one-way tickets, or that folks are able to get together enough money, and some of those fares are relatively low, that they can come here and think that life will be easier on the beach.
Yeah, clearly there's a real draw for people to come to Hawaii, but I think we're in the urban core, and so we do see probably a higher percentage of our new admissions into our shelters as being, from out of town. But we know that as a whole, they make up a very small percentage of all of the people that experience homelessness in Hawaii. But I think, people also need to know there are programs, much like what we do, sending people back home, when they realize, oh my God, I came here and this is not what I expected and I don't really want to be here. So we usually reconnect them with family or supports on the mainland, to get them back. Most of them come, using a check of their own. It's not people sending them usually, although there are times when family sends them, or a social service provider decides that that's probably what is better for them. But that's more a rarity than the typical. I think most people just decide, I want to go to Hawaii because I really want to try something different. And they're just drawn, by the aura of something that, is really advertised, to many people anyway. So I think we know that with the opening up after the COVID pandemic, we knew that they were going to come back because, during the period where nobody was flying in, we didn't see that, but it's come back.
Do you have any numbers on that? Are there numbers on that? Seems like that would be something that would be tough to track.
Yeah, I think James could probably tell you percentage of the whole, but our admissions in the first quarter, of this year was about 30% of the new people coming into our shelters. It's not everybody, but just the new people that were coming into our shelters. A third of them were from, the mainland or elsewhere.
James, you want to add in on this?
Overall, according to the point-in-time count data, it's around 10%. Are newcomers to Hawaii. The vast majority of folks, and especially of our unsheltered population, are local folks that have been in Hawaii 10, 15 years or longer. On Oahu, half of all unsheltered people are Native Hawaiian. So they really are our people on the street that we're trying to bring home. Just to add on to Connie's point, though, the legislature did for the first time this past session appropriate funds for reuniting people with family and community on the continent. And I think, one important element of that is it's not just folks that have come here brand new, but if someone needs help to get to family who's willing to take them in on the continent or a community they're connected to, that resource is available for that purpose also.
Anton, I want to bring in some questions here. Will from Pearl City says, a lot of the homeless have mental issues. How will the state or city deal with these people and get them the treatment that they need, getting them either into a kauhale or other housing? And this other caller says, of all the people that are treated for alcohol or drugs, if the success rate is only 7%, I can't verify if that's true. You'll have to tell me if that is true. But is that worth the money? So what about the people who do have some substance abuse or mental health issues?
So there's a tier of reasons why people are homeless, and it can be mental health issues, it can be substance abuse, it can be economic, it can be a mixture of them, and one can lead into another while someone's on the street. But when you say those numbers, they really are different than the picture, because we've reduced family homelessness. It's the lowest it's been in 8 years, right? We've reduced veteran homelessness, right? So as a person that looks at scalable activities like this, I look at it and say, what can we do to do some segmentations of people that, although you're housing people and solving them one at a time, but there are segments of people that you can apply programs to, because that's what governments do. And so last year we looked at populations that wanted to be housed, especially families. And we took CARES Act money and we applied that into a program called Oahu Housing Now. And we were able to house over 300 families, 850 people. So you saw actually the homeless point in time count come down 17% last year. And so the up 3% this year really is pretty good when you look at that, and actually coming down. And so we're at lower rates. But that being said, when you look at families being reduced, what you end up with are adult households being the predominant number left. And that's what the point in time count tells us. And when you have single and mostly male adults, you're going to have some of these mental health issues, and also the drug issues are going to be prominent in that segmentation. And so you're going to see programs coming out that hopefully will address those folks. And when I looked at my charts that said last year when I was working, I wanted to collaborate with the state. Let's work together and collaborate. The top of my chart this year says partnership with the state. And we're going to be coming out. I don't want to pre-announce for the mayor and the governor and stuff, but you're going to see some written down contract partnerships to address those issues. And we think they'll be substantial, and we're going to move in that direction. I'm writing the contracts as we speak. So we'll leave it to that. But I think that the drug use and the mental health are things that people see too. They're very visible to them on the street. And there's a lot of public safety concerns when they regard homelessness, but it's not necessarily homeless. It's somebody that has a public safety issue. But the mental health issues really do confuse people because you can't predict what someone's going to do. It's foreign to you, the activity that's going on, and so it may scare you. And I think we all deal with that. And so we want to help those folks, but we need to get them in, help them make a decision to engage the system, and then apply. Mental health is addressable. Is very much addressable. Some of the other issues, I know Connie takes on some really hard ones. We helped buy a facility on Dillingham that she's just recently opened up that really does some tough work in detox and those kind of things. But those questions are very good questions, and we need to segment those out so we can address them in segments, but we solve them one at a time.
I want to talk about that facility. Yeah, tell us more about that because it is new and something that could be really a game changer.
So what Anton was talking about is Imiola Piha, homeless triage center that we opened actually just a month ago. And I think I'm super excited about that facility because in the time that we've been open, we took about 29 referrals and took in 15 people. And already we had 7 successful discharges. And these are people who got detoxed. You know, these are people who were on meth and alcohol. Alcohol primary for 2 of them and then the rest of them probably methamphetamine abuse. And that's been the thing that has bothered me like for years. You know, even when I was at the state hospital, I saw a lot of people coming in who were chronically, you know, using methamphetamine, and it just destroyed their minds. And so, you know, I see them on the street now, and I really felt like this is a population that we really have to tackle. So with the help of the city, you know, giving us HUD funding to acquire the facility and the state providing, the legislature giving us a GIA to start the first year, it's just been remarkable because I think we're looking at some successful, you know, discharges having to do with the kind of help that they're getting. They're coming into a space where it's just totally different from being on the street. It's clean, it's beautiful, it's quiet. People can rest, you know, for the first time in their life and eat as much as they want to, and they are just, you know, really making recoveries that, you know, we were not fully expecting, but we're so happy to see. And even though some of them laugh, you know, they really went after being detoxed already. And I want to say one more thing about mental health because, you know, we've been very much in that field, and the city again funded, you know, a program for the last few years called the Outreach Navigation Program that helps us to actually have an attorney help us petition for court-ordered treatment for people. And that has been super successful after we tweaked the law a little bit more because the statute was at first not so friendly, you know, to us using it, but we've since been able to just really help a lot more people with medication. And we're using long-acting injectable medications that really help somebody sustain being treated for like a month or 2 months, where before you'd have to take medication every day, you know, but you don't have to do that anymore. So we're seeing remarkable, you know, really changes in people.
Yeah, and I want to, you know, clarify for the audience because I don't think enough people are aware of that particular program, and I think that that's a really interesting idea. If you could just tell us a little bit more about the numbers, you know, just so that folks are clear. This is when you see an individual on the street who is clearly maybe experiencing a severe mental illness, you're able to actually engage them and give them medication, you know, on the street. How does that actually work? You know, if you have to get a court order, how quickly can you do that? How many people have you been able to service, and what happens next after they receive that medication?
The beauty of this program is that the focus wasn't just getting court orders, although we do guardianships and we do what we call assisted community treatment orders. Over half of the people that we've helped to get treated, we didn't even have to go to court. You know, so they're taking the medications, and I would say there's about 150 to 200 people that we've been able to actually help medicate. And the ones that we do go for the assisted community treatment is because they really, you know, refuse it. But if we get the order, they don't get treated right away on the street necessarily. We take them into the hospital, and then they're treated there initially, and then when they are on the medications, we're able to basically place them elsewhere, or even if they come out, they're getting better, and we continue to outreach, and eventually many of them are really open to housing finally, because at the beginning you can't just even have a conversation with some of them.
I think that to that point in that area, one of the things that is a root cause to homelessness are families can't deal with a mental health issue. And they end up, the person ends up leaving. There could be some abuse involved. So there's an organization, and I want to, for that viewer that called in that question, it's called NAMI Hawaii. And they have a number, 591-1297. And for a family out there that has a family member that's in the house that are struggling like that, or you've lost somebody because of that, give them a call. They can give you a lot of tools to help you there and can help that family unit. And if you can reunite that family unit, it's a beautiful thing.
I just want to add something to what both Connie and Anton said, and acknowledge what your caller said, which is this is a really hard area, right? And treatment outcomes long-term are not great. I mean, even the best tools we have, for someone to recover and stay clean and sober and fully heal from mental illness, it's tough to get those outcomes. And I think what Anton's speaking to about reuniting families does come back to the importance of supportive relationships for people. And so in addition to trying new things like facilities and treatment, I think we also got to be looking at, as part of trying something new, at ways to build supportive community for folks. And if their family unit can't be that anymore, to build a new sense of family for people. Before taking this job, most of my time I spent building relationships with folks on the street. And I know several dozen people that have gotten clean and sober, and every one of them got clean and sober. Some of them went through program, but every one of them, many of them didn't. And every one of them that got clean and sober over time had the help of someone they loved and was often doing it for someone that they cared deeply about. And so I think that's an important element of addressing this issue too.
I want to bring up that graphic one more time, the last one that we looked at about the unsheltered population survey, and talking about the conditions that a lot of these folks are facing. Again, just for our audience, just as a refresher here, 62% or more reporting a disabling condition, 39% reported a mental illness that we just talked about, 36% were chronically homeless, and 22% were 60 years or older. Let's talk about that older population. And Adam, I want to start with you. Sarah has a question here. On the mainland, they have developed apartment buildings for seniors. Current development does not have these types of housing. Are there plans to build these types of apartments? What are you seeing in terms of resources for kupuna in your community?
Well, we certainly need more, but we did just break ground this month on a brand new 40-unit senior housing facility for low-income families. It's not specifically for people who are homeless, but it will certainly serve the homeless population, and we can do more. We've got an aging population, so the need for senior housing is only going to grow. And I want to circle back quickly on what we were just talking about. Clearly, there's multiple reasons for someone being homeless, and therefore there are multiple types of solutions to suit them, to fit each situation. But the one commonality they all have is they have no home, and it's very difficult to address whatever issue someone has if they're living, if they're curled up on the sidewalk and they're having to move every night and being rousted from where they go. So providing that basic shelter and some sort of stability so that whatever the issue is, whether it's mental or substance abuse or addressing physical issues, can be addressed is the first key element, yes. Whether they're kupuna or somebody who's 30 years old. Mm-hmm.
Anton, I know you talked about the impact of just having an aging population overall, that we do have, quite a large number of seniors in our community, and those are only growing. But what are your concerns specifically when it comes to the elderly and homelessness?
Well, homeless takes a real toll on lifespan, and really the figures range from 10 to 15, some people even say 20 years it can take off someone's life. So someone that's homeless, that's over 60 years old, is very exposed, right? Their ability to withstand not just the elements of being homeless, but also the people, the issues, and everything. And their nutrition is low, and they're not getting the kind of food they need. And they're disconnected, right? And they can be lost. And I think that's a real struggle. And I think that as we have this growing population of aging in our island, that all of that plays. We have to keep people connected, right? Their finances may not allow them, and they could become homeless, right? So there's just a lot of issues. We are celebrating Haleiwaulu opening up in Chinatown in September, and that'll give hundreds of units for seniors. What I like about that too is it'll give a gathering place for seniors. And back to the relationship concept, if seniors have gathering places, it really works. I know during COVID we did a lot of meals and everything else, but we had programs all about connectivity, so people didn't feel isolated. And so someone that's aging and homeless is very isolated, and that can be very detrimental to their health.
Yeah, and Connie, as a service provider, I would imagine that housing someone who is elderly would have very different challenges than housing someone who may be young and more physically able.
Oh, definitely. And there's healthy aging and there's unhealthy aging. And I think to what Adam has been saying about needing a place, the place is so important, but I think those services, are equally important, because what we're dealing with when people are coming into the shelter is seeing that there's multiple layers of problems. Some people are already suffering early dementia. Some people are, very frail, and they easily, get hurt. And so having places retrofitted and really thinking in terms of assisted living, where people get the care that they need at the time that they need, and so as they need more care, somebody's there to provide it. Someone like Adam's building the housing, we need service providers that can actually help with the services for those people. I think, and the folks that are helping people who are aging really need maybe more training in some ways to recognize all the different things that could be going wrong. How do you distinguish between somebody who's suffering mental illness versus somebody who has dementia? How do you know when somebody is actually so, like Anton says, has nutrition problems, and that's what's causing some of the mental disorders that they're experiencing. So I think it really does require some assessment, and I think that we have a lot of, opportunity to get better at it. But I'm really thankful for these guys and the ways that people are bringing more housing on board and then also more services.
I want to bring in this. This is a question from Cheryl on Maui, and this is a question that's directed to you, James. How does the government prioritize tackling homelessness? For instance, it seems that they clean up homelessness near tourist destination areas rather than in non-tourist areas. This, of course, is a statewide issue, and some communities feel like they're low on the list. How does, we only have so many resources. If you're going to build that dozen in the first term, how do you decide where they go and who gets access?
Well, so one thing I want to clarify is that as far as enforcement and, getting people out of an area, that's not something that our office participates in or is in charge of. And so we're not deciding which areas to get people out of. So there's no prioritization on that. Our focus, as I said, is on creating those spaces to bring people home, because that's what's going to end this challenge permanently, right? Get that people are frustrated about having homeless people living on the streets in their neighborhoods, but the solution to that is we got to create space then for those people. And so to your question about where this will happen, part of Governor's message is this has to happen in every community. We've got to find space in every community. That was the reason he wanted the medical respite kohale where it is, which is about a 90-second walk from Washington Place and 90 seconds to Queens Hospital. So it's right in his backyard. And that was intentional because he wants me out there, he wants to be out there saying, we cannot choose not in my backyard when it comes to homelessness or the facilities and housing that can house and serve people experiencing homelessness. If we are going to stick with not in my backyard, then we're choosing homelessness. So the short answer to your question is every community. As far as kohale themselves, Governor has said he wants to target 6 on Oahu and 2 in each of the neighbor island counties. Now, that's not a hard and fast number. If we can stretch the resources further and leverage community resources to make it, we may do more than that. But that, generally speaking, is the goal.
Okay. There's another question here from Waikiki asking if the CORE program has been suspended in Waikiki. We know that the focus had been Chinatown and the downtown area for CORE, and just for folks who aren't familiar with it, if you could tell people briefly what CORE is and how it's been working and where those resources are going.
Oh, excellent. CORE stands for Crisis Outreach, Response, and Engagement. And when we developed that program, you folks were involved in the development of it, and we brought together state officials in a state at a county table developing a county program. We brought service providers to the table. We brought some business leaders, some from Waikiki, and then we also had, and James helped with this, 2 individuals that were homeless, so that we could try to understand what it's like when somebody approaches them. What's that world like? I mean, I could imagine it in many ways, but I can't really know that. And so when we devised the program, we ended up saying it's an alternative to an HPD response to a 911 call, that someone's homeless, it's not a crime. And maybe we can then approach someone with some sort of service. It could be a medical service, it could be just working with them, getting to know them, and trying to build trust, a beginning of a relationship that could build some trust. Again, back to that idea of a creative way to get someone to make a decision to engage the system. And so we've been building that up. I think one of the key strategic items of CORE is that we made it a city program. When we looked across the country, other cities contracted with service providers. And then what happens is the program becomes static because service providers only service their contract. In this case, it's the city, so we can pivot and move. And so right now, to particular about that question is, CORE has moved itself into the Evil Resource Center. Most of its resources are continuing to grow and hire. It's going to be a medical respite. And we have 19 beds there. And so temporarily, probably till maybe this fall, the end of the year, we're going to do a medical respite there. The strategy of medical respite is if somebody can stay there for a while and heal. And while healing, you can get to know their story. And if you can get to know their story, maybe you can come up with the right solution for them. Again, it's a program, but it's a solution one at a time. And so right now, CORE does make visits to Waikiki, but not as much as it did 2 months ago. But we also have the Safe and Sound program in Waikiki, which is working, and added security in Waikiki, which I think will also make a difference. So we haven't lost focus. Chinatown looks a lot different than it did 2 years ago, and now we're implementing the medical respite. But CORE is still hiring. Jim Ireland and Ian Sante, they're passionate about what they're doing, and they're continuing to grow that program, and the mayor's committed to that program.
I want to bring in a viewer question here, and Adam, this one is a good one for you. You talked about the housing that you are building and the families that you're able to help, and it sounds like those folks, they really want to get out of that circumstance, and they really need those resources, recognize that, and want to move on. But this viewer writes, what is being done to address the chronic homeless, and we did have that graphic there that said that 36% of that unsheltered population in the point-in-time count reported being chronically homeless. What is being done to address the chronic homeless who do not want to abide by the rules to get help and housing? How do you address those folks?
Well, that's difficult. I mean, like Oahu, Kaua'i experiences sweeps of encampment areas. Like James's office, my office is not involved in that. Our mission is to provide housing units, but it's a complaint-driven process. I'm not sure how we will solve that problem. It's right now we're at a point where we have so few units to address the willing folks who want assistance. That's what we're focused on now, to address the people seeking help, in need of help, who we don't have the resources to serve. At some point, you could envision. I can envision, and I don't know what this model would look like, that there has to be eventually not just carrots but a stick of enforcement. But that can't happen unless we've provided sufficient resources to provide genuine solutions for the people who are willing to accept it. And then the stick comes in when we've got a public park that the public demands to use, and it needs to be made available, and it needs to be made safe. But I think we have many steps before we can get to the point of sweeping people away.
Yeah,
continually.
I'd just like to add something quickly to what Adam said. In my experience, a majority of folks who are on the street, it's not that they don't want help or they don't want to follow rules. In many cases, they've given up on the system. And part of the reason for that is we've had this big bottleneck at the end of our systems. We promise people, come into shelters, sign up, get eligible, sign up for services, get a case manager, we'll get you housing. But getting people into that housing, that last step has been so difficult that people spend months or years in shelter, cycling in and out of shelter, going back to the street. And after a while, they've given up. They say, we've heard this before. I'm not going to, I don't have faith in the system to help me in the way it's saying it can help me. And so part of it is freeing up that bottleneck at the end so that we can make good on those promises. And then part of it is fortifying that system so that it works really well. Whatever obstacles and bottlenecks there are on that journey from street to home are cleared away so we can get people quickly along that path and bring them home.
Yeah, Connie, I'd love your thoughts on this.
Yeah, I agree with James. There's a lot of people that have suffered trauma over trauma, over trauma on the street. And for a lot of them, they have given up hope. And I think it really means we need to be there, meet people where they're at, to really encourage them and invite them into a different kind of space. And similar to what I said earlier about our homeless triage center, that is one way to just tell them, hey, there's a different way. Here's a way that you can come in. But again, to James' point, we need some place for them to go afterward that really keeps them going on track. I think for some of the folks, who are on the street, they are victims of crime as well. And I think for those people who are committing those crimes, we really need to help the police, actually tamp down on some of that violence that's going on. We've had to reach out to the police, many a time, to just really help some of our folks who have become victims as well. So we right now really work very closely with the community policing teams, so that we know who they're dealing with that, are committing some of these crimes. They can tell us who they think are mentally ill, so that we can go and actually visit with those people. So it's been a wonderful, partnership with HPD as well. So I think there are many opportunities for us to collaborate more, to just be able to, use our different strengths, to come together. And I often will call the prosecutor's office also when, somebody who I believe is more mentally ill, and even if they get picked up for something, maybe they need to be diverted to the Hawaii State Hospital for assessment. So there are different tools that we are using, but I think we just need to have everybody get on board about how to use them better, probably.
We've got a flood of questions and only about 10 minutes left, so we want to get to as many as we can. Shelley on Facebook wants to know, and Anton, I'd love for you to take this on because you mentioned the myriad of agencies that you are in charge of. What are we doing to prevent our residents from losing housing? Let's talk about the folks who are vulnerable and right on the edge. I know that the city has, released quite a bit of rental assistance, and tell us a little bit about that.
So the city embarked with federal aid on rent relief and utility relief. And it was a very strategic way to deploy it. And so what we did is we partnered with Catholic Charities and our Hawaiian groups to do that. But even before that, we reached out to many service providers so we could reach the communities of people that needed that. And so this program has been one of the most successful in the country, and our Office of Economic Revitalization runs that program. And it was so successful at the highest rate, we were awarded nationally for our success in that. And I think that had a lot to do with people not becoming homeless. And so we just reopened that program. And so we reopened it, it got applied for, but now we're starting to do satellite pop-ups so people in the communities can come and apply again. So we'll continue to do that. When the eviction moratorium went down, we were very nervous about that situation, but it hasn't occurred like we thought it could have. And so I think we've done a good job in that arena. We also do other programs where, for our service providers who lost money during the pandemic, right? We have relief for them, and so we have a program opening up again, a second taunts, where they can come in with their financial records, and we can just reimburse them, and they can use that money for whatever they need to use. So a lot of those are preventive measures, because if we can prevent somebody from being in the street, then there's fewer people that we're working with.
Yeah, Adam, what about the resources on Kaua'i? We know that the housing market is very tight there as well.
It is a level of extreme desperation, and like the City and County of Honolulu and Anton's office, we distributed over $30 million in rental assistance during COVID, and we've got a record number of Section 8 vouchers supporting housing, and we like to pat ourselves on the back for our success in administrating those programs, but it's kind of the flip side is the level of desperation that needed all of that assistance and that needs that level of Section 8 housing. It's a symptom of something much bigger than just our success in administering the program, and that was great that we were able to provide that assistance. But on Kaua'i, that money's gone now. Mm-hmm. There is no federal pool of $30 million in federal money. So I fear the housing crisis has only gotten worse as far as the cost of housing on Kaua'i, which is now average home is $1.15 million. Something close to 24% of our housing units are considered vacant, being used as resort or vacation homes. Mm-hmm. And we've got an increasing number of homeless people on the street. So it's a desperate situation. And I applaud my staff for doing a great job administering those programs, but it's a symbol of problems, deep problems.
I want to get to this question in Wahiawa. It says, question for James. You mentioned the focus of the governor not on moving homeless in and out, but on providing housing. Is Wahiawa Hospital on the list or an option to consider? Perhaps not that facility in particular, but more broadly, what kind of creative solutions are you looking at in perhaps transforming spaces, taking other existing state properties? I mean, what's on the table there?
We're relying actually heavily on community partners and folks maybe like this caller who have ideas, suggestions, locations, you know, and since we announced the Kohale initiative, folks have stepped forward. I can tell you there's, you know, a nonprofit organization in Wahiawa that's looking at space right now. There are churches that have come forward and said, hey, we have a parcel of land. We'd like to put a Kohale here and house some of our people in this space. We have private landowners that have stepped forward and said, you know, I have a piece of property. Can you do something with it to help address the homelessness challenge? And we're looking at state-owned properties as well. But to me, the key is having strong community partners to help lead the charge, because that's part of, it's going to do two things. One is that's part of the way we address the NIMBYism. If we have someone from the neighborhood that's saying, I want this here, and I want to champion it, and I'm going to speak up for the need for this, that's one way to get over that hurdle. The other thing is, it's the community partners that are going to make those spaces feel like a community and feel like home and connect the residents there with the surrounding community. Because bringing folks home is about more than putting a roof over people's heads. It is about having that sense of belonging and connectedness. And government isn't going to do that. It's going to be the community partners that do that.
We have about 5 minutes left. I want to make sure I get to hear from each of you. And I want to sort of go back to where we started. You know, we looked at those numbers, and year over year, they are up. If you actually look over the trajectory of the point in time count, things did get quite a bit better than in years past, but we still have so long to go. This feels different now in a way. You know, you see a lot of people coming together. So I'd like to hear from each of you, because we know that you're in the trenches. What do you think is different, and what kind of strides, you know, when people look at this issue, they feel overwhelmed, they feel frustrated. So what's different now? We'll go around the table, so maybe a minute or less each. We'll start with you, Adam.
Well, I think we've reached statewide, federally, and at the counties, I think we've kind of reached an apex of concern about housing. And we're luckily, as that attention has grown, state, federal, and county governments are all very much in the black right now. So there is excess funds to spend on these issues, and there's lots of programs happening. There's more being spent on housing and homelessness. But I fear that perhaps the good days may be limited, and I worry about how we will be able to continue the successful programs that are ramping up right now 4 or 5 years from now.
Connie, what gives you hope about, what do you think is different about this moment?
I think the partnerships, you know, between state government and the counties, and also, you know, with the federal funding that's coming through, it's unprecedented, I think, you know, but I think that we really need to be wise about how we build the system, and I think we need to build in a balanced manner. I think I want to just put a last plug in for two things. One is really being able to use data, you know, to really look at, you know, making that progress and to see how we can target certain subpopulations, you know, to, help. The other one is I hope that the state also, and this county, really looks at funding the resources, giving the resources to the frontline people that do the work. Because if we can't pay people so that they survive, I mean, they're just not that much better than some of the people that we're helping, and that's not good.
Anton, what's different about this moment?
Well, first off, we bought a 24-bedroom place in Wahiawa, so we'll put a solicitation out for use there. But just recently, the Secretary for HUD visited, and when she visited our islands, what she recognized, which I believe is to your point of your question, is we're at a time where the congressional delegation, the governor, the mayors are all working together, and she's never seen that kind of collaboration and partnership before, and I think we need to take advantage of that and do all we can to leverage it, because in the end, we need beds of many flavors.
Okay, and James will give you the last word.
Yeah, I would echo what others said about collaboration. I think that makes this moment different. The other thing that I think is different, and maybe it's just emerging now, is that we are having the ideas and initiative and voices of people who are living homelessness or who have lived homelessness recently be part of the conversation. That's informed a lot of the strategies that we're now putting into place. It's informed the Kohale initiative because we heard from people that that's the kind of space that they would want to go to and want to live in. And it's informed the emphasis on community. But I think having those voices and their initiative and their ideas at the table is also a game changer. It's been a game changer for me personally, and I think that is also kind of nudging us in new directions.
I want to squeeze in one more question from a viewer, if you could take this one in the last 30 seconds or so. How can regular citizens help solve homelessness? This is from Paul in Mo'iliili.
Well, two things come to mind. One is, as I mentioned, kauhale, and it doesn't have to be limited to kauhale, but I think every one of the projects that we're trying to put in place to serve or house people experiencing homelessness can use the support of everyday people. That might be just coming out to volunteer, have lunch with a person, bring a meal for somebody, donate supplies, but be part of the projects in your community, in your area, and most importantly, take the time to build some of those relationships and connection with folks who are experiencing homelessness, because again, that mind shift is going to be the game changer. And it's related to the second thing I would say, which is everybody can participate and help by shifting from the NIMBYism to YIMBYism. I mean, if you go to a community meeting about homelessness, most of what you'll hear is complaints. We need people to stand up and say, you know what, I want to be part of the solution. Yes, I support having this group home or treatment center or housing in my neighborhood.
Okay, well, mahalo to you for joining us tonight. We, of course, do thank our guest, James Koshiba, the governor's coordinator on homelessness, Connie Mitchell, the executive director for the Institute for Human Services, Anton Krucky from the City and County of Honolulu, and Adam Roversi, the housing director of Kaua'i County. We are taking a break from Insights next week, but we will be back on July 27th when we will be discussing the state of our roads and highways. They do need quite a bit of work. Please do join us then. I'm Yunji de Nies for Insights on PBS Hawaii. Aloha.
Local broadcasts of Insights on PBS Hawaii are made possible by the support of viewers like you. Mahalo, and by First Insurance Company of Hawaii, protecting Hawaii's families and businesses since 1911. Ulupono Initiative, building a more sustainable Hawaii by investing in local food, renewable energy, clean transportation, and waste and freshwater management. Hawaiian Electric, helping residents and businesses prepare for hurricane season. Visit hawaiianelectric.com/safety to get your emergency preparedness handbook. Carl Smith Ball, providing legal services throughout Hawaii and the Pacific since 1857, making a positive difference in the communities where we live and work.